Hello, and thank you for joining us tonight for our free webinar, Empowering Pregnant Patients on How to Prepare for Birth, featuring Amy Major. My name is Jeff Bloom, Education Marketing Manager here at LASA-OMS. For over 40 years, LASA-OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please make sure to use the Questions tab to the right of Chat to assure that we see that during the questions and answers. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA-OMS blog. Now for our featured speaker. Amy was first certified to practice acupuncture back in 1988. She is a fellow of the American Board of Oriental Reproductive Medicine. Additionally, Amy is a childbirth educator, birth doula, end-of-life doula, and a trained lactation counselor. Amy apprenticed with midwife and acupuncturist Dr. Raven Ling for over 2 years while completing her MS in Chinese medicine at the DACM. She's published in books Parenting from the Heart and Round the Circle on Huffington Post. Amy has been working with pregnant women since 1987. She earned her DACM from Pacific College in 2017 and has a radio segment with Denise Vazella on WHMP called Major Healing with Amy Major. Currently, she practices at the Wellness House in Northampton. Lastly, she's also involved with legislative advocacy at the state and national level, working to get insurance coverage by all acupuncture providers for acupuncture and evidence-based non-opioid treatment for pain. She's also the vice chair of public policy for the American Society of Acupuncturists. Please join me in welcoming Amy Major.
Thank you so much, Jeff. So one thing I forgot is during the pandemic, I became a certified hypnotist because that's one of the skills that serves my pregnant and fertility patients, as well as patients in pain. Jeff, the slides are not working? Thank you. Okay, here we go. Softening, ripening, opening, and recovering. So if there were 3 words that I'd encourage you to give your pregnant patients, starting at 36 weeks, because it's a process and not an event, those words would be softening, ripening, opening. When we say the word open, it relaxes our jaw, which relaxes this mouth or us, and open, relaxing our jaw, relaxes the mouth, the os of the cervix. Course goals: to provide you with practical tips to support pregnant patients in preparation for normal physiologic labor and birth, to help you create and learn about mindful ways to pay attention and offer care during the postpartum period. What to look for, what not to miss, what are the big red flags that need more support beyond the care that we can offer. And simple tips to support breastfeeding women or the chest-feeding relationship, depending on how the birthing parent is feeding. Jeff, there we go. Okay. The most important skill that I hope you gain is how to use language to create the space for your pregnant clients and their precious ones to have the best birth experience possible, no matter how they birth. They're working as a team. If you don't already invite your pregnant clients or patients to work with their baby and remind them that they're a team, I want to invite you to do that. Just this evening, I asked a parent, I said, okay, so your last name, and all of these are made up, your last name is Jones. And is the baby's last name going to be Jones? And she said, no, it's going to be Smith. I said, okay. So this is Team Smith Jones, and we work together. And that's language I want you to use with baby. Remind baby that you have worked together to grow. You're going to work together during labor, and you're going to work together in the breastfeeding process, right? And that also is a process, not an event. Okay. So how my experiences have shaped how I practice and why I practice the way I practice. Maury, and Luis were three incredible people who helped me define how I wanted to be authentic in whatever I did, right? When I was in school, I apprenticed with Raven Lang. Before I got to school, I read Suzanne Arms in Maury Stein's class, The Sociology of Birth and Death, right? And reading that book gave me a lot of clarity around the way that women were treated in birth, that women and pregnant patients who are not identified as women give birth, are treated during birth, during pregnancy, and what I wanted to create, not only for myself when the time was right, but for those that I worked with. You know, I decided pretty early on not to go to midwifery school because I'm not good in the middle of the night. But doing adjunct support work with midwives, that's up my alley. Maury Schwartz is the other Maury, and he demonstrated presence, compassion. Maury Schwartz is the Tuesdays with Maury, and he demonstrated by being himself how we show up and create space for another person. Luis Iglesias was a Cuban spiritualist who taught me to keep learning and growing, and that's an invitation I give to you. Jeff, thank you. Creating the invitation for birth. How do we do this? So one of the things we're going to do is talk to the mom, right? The title of this, Softening, Ripening, Opening. When you're working with pregnant patients, creating the invitation to breathe in through your nose and out through your mouth. Just doing that, which many of you already know, changes brain chemistry. Acupuncture changes brain chemistry, right? When we invite this person to breathe softness down and down into her cervix, that brings softness down to her cervix, right? At 36, 37, 38 weeks, you know, contractions are not the concern. Making sure her cervix is soft and ripe so that when contractions happen, then they'll be effective. Now that's our concern. Another thing we want to invite them to do is to invite their precious ones to move down. And I always ask permission to speak to their babies, and I'll say, you know, precious one. And I did this again just this afternoon to say, precious one, we're asking you to move down. We're asking you with each breath that your mama takes to dive right down on your mama's cervix. You can move down, precious one, by wiggling your head. You can move down by pushing up with your feet, or you can find another way that we don't know about, precious one, because you have innate intelligence and we trust that. Slide, please. So this is a beautiful image that's on my website. You can use it from the slides with attribution. You can take it from my website for pregnant patients. When babies are breech, one of the things I invite patients to do, right? I invite clients to turn all the photographs in their house upside down. Why? Because we're used to seeing people feet first. And we want to get in the visual cortex, seeing human beings head first. And people laugh, and yet 2 babies have turned just with the act of turning photographs upside down, right? So, you know, one of the reminders is that babies understand everything but highly technical language. Talk to them throughout the day. Encourage your clients, your patients, to talk to their precious ones. One thing I often do is encourage them to pick a rhythm. Doesn't matter what the rhythm is. But as long as they use that rhythm when baby's on the inside, if they use that same rhythm when baby's on the inside, what happens is baby a skill and a tool to transition from the inside to the outside. And babies melt because they love this and they know this and it's familiar. Jeff? Thank you. So if there's one other thing that you walk out of here with, it's the Candace Pert quote. Every thought we have, every emotion we experience has a direct, measurable biochemical reaction in our bodies. That's really powerful because women are told awful things. And sometimes women's families or pregnant people's families tell them difficult things. Sometimes it's when they're nursing. I had a patient come in Monday morning and she was told on day 2 after her baby was born that the lactation counselor didn't believe that her milk was going to come in ever or that she was going to be able to support her baby. And the woman in question is a healthcare provider. And she said, you know, I know this person has lots of experience, but I don't want to believe that. And I said, you know, I want to invite you to believe that that could be possible, but it could be possible for your milk to come in. And I want you to talk to your breasts and I want you to talk to them about milk flowing. And so we sang a song that Raven Lang taught me that can be used for birth, that can be used for menstruation, but in this case, we used it for milk flow. Let Jeff know in the chat if you want me to sing it. We can sing it at the end if you'd like. But the script for pregnant people is softening, ripening, opening, right? When we say the word open, it relaxes our jaw. It connects directly with our cervix, with the cervix of the birthing parent. And this is one of the things, this is a gift you can give them to take to their labor, no matter what, right? And you're providing value for that person. You're providing value for their labor, for their family. And that's a beautiful and important thing. Slide, sir. Okay, the cervix starts back high and tight, right? It has to come forward, soften, ripen, and open to 10. That's a process, not an event. And that's why I keep saying we want to breathe softness down and down and down to the cervix. Now, remember I talked about hypnosis, so why am I doing that with my voice? Right? When we bring our voice down and down, and we encourage baby to move down and down, using that tone helps baby move down. That's another gift you can give any parent that's free, and you can do it tomorrow. Slide. So, you know, for me, it's all about the small things that make a difference. Words have power. We want to be careful how we use them. Right? We want to be careful what we're telling ourselves and what we are telling what our patients, clients are telling their babies. You know, if baby is in a funny position, does mom say, ow, you're hurting me, don't hurt me? Or does mom say, precious one, please move down? Or birthing parents say, precious one, could you move down? Or stretching over instead of rubbing on baby's foot, right? We want to help parents think outside the box as they're growing this precious one and as they're uncomfortable. Because as anyone knows, I've only had 6 children, but my husband can attest, I was slightly uncomfortable at times. So things we need to know to best support our birthing patients are, where's the patient giving birth, right? If we know the patient has chosen to give birth in a place where they're going to have an episiotomy, because that is the standard at some places, we want to support the patient to recover from the episiotomy rather than tell them how awful it is to have one. Do I believe it's the best thing? No, I do not. But if a patient tells me they're going to a hospital and they want to have one because of their fears or fear that their OB has, that is their decision, and my job is to bless them and support them, right? If they intimate at all that they'd like to find a practice that doesn't have that as their standard of practice, I can give them a freestanding birthing center and 2 other midwifery practices. So know where your patient's giving birth and what the options are in your community, what the procedures are, what the C-section rates are. Because sometimes people choose someplace close, but they don't know that that place has a 38% C-section rate. And for anyone who doesn't know, the World Health Organization writes that the C-section rate should not be higher than 15%. Most hospitals are much higher than that. So know which hospitals in your area have lower rates than that, because that, again, that allows you to provide value to your clients. right? And what providers have they chosen? Have they chosen nurse midwives? Have they chosen OBs, right? Those are two different trains with different trajectories and different systems in place. And so knowing what those policies are and knowing what's likely to happen for your clients, for your patients, and how you can best support them will make a difference and provide value, right? Which ticket did your patient buy which train did your patient buy a ticket on, right? Next, please. Sir Jeff, thank you. Okay, so to empower your patient, what does that mean? It looks at what we can control and what we can't. We can't control when those contractions are going to come. We can help them learn to work with them. Again, we're back to breathing in through your nose and out through your mouth. My husband's teacher, who happens to be a chiropractor, says, nobody walks into an ER going, I'm having a heart attack, because it's impossible to hold your body in a tense way when you're breathing that way and turning your arms out instead of in. Just teaching a spouse or a partner or a birth partner to turn the hands over and remind the birthing person to breathe in through their nose and out through their mouth. So what are some other things we can do? Share resources. I have a number on my website. They're linked throughout this. Funny movies. Why? Again, we're back to relaxing the jaw. Someone once said to me, I have all my pregnant women watch really sad movies. I said, why? And she said, because they cry and it relaxes their jaw. I said, I go the other way. I have people watch movies that make them laugh so hard they might pee, because that also relaxes your jaw and it lightens things and it opens your chest, right? And we know from the lung kidney tube, right? We want the chest to be open so the tube functions, the lungs, the kidneys, everything is working well for this precious one to descend and baby to be born. Why do I have up here baking bread the old-fashioned way? Well, we're back to softening and ripening the cervix. I tell folks, you can bake bread with everyone in the family, but I want the pregnant person to punch down. Why? Because when they do it, I want them to do it really slowly and feel what it feels like for that dough to ease out of the way and accommodate their hands. And I want them to breathe into their cervix so their cervix is that soft. And what happens when we use this imagery? I have midwives telling women, well, you're not dilated yet, but wow, is your cervix soft? And again, why does that matter? That matters because contractions can be effective when the cervix is soft. Then when contractions happen, then they're effective. My first child looked like the Travelocity gnome because my cervix was so hard and he kept butting up against it. I was having contractions, but my cervix wasn't soft. So I have become the queen of preparing the cervix, softening, ripening the cervix. For some women who aren't going to bake bread, walking in the sand or walking in the mud barefoot is a better image for them. If they can do that where you live, encourage them to do that and encourage them to focus on feeling the mud again or the sand moving out of the way to accommodate the weight of their foot, right? And breathing down and bringing that into their cervix that it can be that soft to accommodate the baby's head and ease out of the way, right? And again, I encourage patients to talk to their babies. Babies understand everything but highly technical language. And engaging their cooperation is going to help. Okay. So these are 3 different things you can download from my website, and they're all going to prove valuable to you and to your patients. You are welcome to use them. You're welcome to print them because our goal is to provide value. And on this, humor goes a long way. And I just told this person who left tonight, who's 41 plus 0 today, to, who I said, are you being intimate with your spouse? And she went, ugh, I don't feel like it. I said, okay, so I want you to put it in the never turn down a perfectly good orgasm department. That's going to build oxytocin between you and your beloved. That's going to relax your pelvis and it's going to feel good. There is worse homework than an orgasm. And you can remind your partner that they need to take one for the team because, this is what you need. And if your partner does not have access to sperm, then orgasm is still a good thing, and you can insert 4 capsules of evening primrose oil high up to get prostaglandins right on the cervix. Next, please, Jeff. Okay, if you see pathology, of course, treat it, right? Otherwise, be present with and meet your person where they are, right? We always want to use differential diagnosis, even when we're supporting someone to go into labor. Like, what was up with the Sally? You know, my patients are all Sally and Fred. The Sally that came in today, she was really stressed. So liver 2 and liver 3 were part of her needling pattern. And she fell asleep within 3 minutes of the needles being inserted, even though she'd never had an acupuncture treatment before, and she was really concerned about having acupuncture. When the spleen chi is strong, the birth is easier. What do I mean by that? When a river is flowing and the banks of the river are well supported and firm, the water can flow more strongly and it doesn't get murky. When the banks have sunken in, it's much harder to help that baby drop. So please don't be afraid to use stomach 36, Moxa on stomach 36 by way to strengthen the spleen, and think of it as being strong to support the baby to drop and the shores to be able to tolerate that well. You know, each pregnant person has fear and anxiety in different ways. For first-time parents, it's really different than second-time parents who may feel like there's just not enough love for that second one. So again, we want to hold up the mirror and say, you know, your first child is never going to look bigger to you than the day your baby is born, because all of a sudden this toddler looks like a giant next to this tiny person, right? So your willingness to be present, provide value, and listen with an open heart goes a long way. Next, please. Okay, so resources within our community that we want to use, right? If you really want to work with fertility, pregnancy, and postpartum, I highly recommend you become an ABORM fellow, because there are certain fertility practices that only refer to those who are ABORM fellows. Deborah Betts has resources both for acupuncturists and for patients, clients, that you can download from her website. Claudia Sitkovitz and Kate Levitt work with Deborah and Zena Koshar with MAMPS, the Maternity Acupuncture Mentorship Peer Support Program. I was a TA for them. Also, Sharon Weisenbaum's White Pine Circle, right? And when you study, look for what resonates with you, because that might be different than what resonates with me or someone else, because we each have our own unique gifts, and I want you to maximize yours. Next slide, please. Okay, so what do our source texts teach us about how we use Chinese medicine around birth? The Fu Ren Liang Fang, Fine Formulas for Written, was written in 1284 by Cheng Zimeng about the 4 aspects of labor preparation, some of which we've already talked about, right? Making sure the parent has the space to be centered and not worried. Making sure the birthing parent is moving, but not too much. So what does that mean? That means if you have someone who is told, well, at this facility, you can't get out of bed in labor, you may want to be able to provide them with a couple of other places to birth where women can move as they need to. Again, I've only given birth 6 times, but I can tell you I was in motion constantly, you know, because that's what worked for me. Making sure the birthing parent is eating, but not too much. So part of this depends on what the policies are at the facility where the person is giving birth. But if they're at your office and they're hungry, encourage them to go home and eat. Because even if they throw it up, they'll still get nourishment. And it's okay to throw up in birth, and it happens. And so you may want to keep barf bags in your office. I do have them at my office that have, you know, just little hearts on them to remind people that it's okay, that it happens. It happens in early pregnancy. It happens in labor. And making sure the birthing parent is sleeping, but not too much. So part of that means, you know, if you can bring the partner in and connect with both of them, that's a good idea. If you're not comfortable having them both in your office, this is a terrific way to use telehealth and teach acupressure for birth and spend some time just giving them love and support and encouragement. Next, please. So the source text recommends using the 13 Princes formula starting in the 8th and 9th month. In my practice, I start at 37 weeks because some women are very shy about taking herbs, and 37 and a half weeks is term, right? And we want more research that is done in this country because that's how the healthcare system in this country works. It depends where your patient is, right? We don't work in a vacuum. Many providers have concerns about doing too many things that could stimulate a baby, that could encourage a baby to come prior to term. Next, please. Okay, so what is the 13 Princes and how do we use it? This formula is about balance and relationship, right? Jiu Dang Hui, wine treated Dang Hui, Chuan Bei Mu, Huang Qi Bai Shao, Tu Se Zi Ho Po Aya Jing Jia Sui, Zhi Chuan Xiong, Qiang Ho, and Gan Cao, right? These are in source text. This you can ask me about, this you can look up. This I have women sip, not chug during labor, right? Because we want the formula to do its due diligence. So have her make a big pot or give it to them in granules and have her sip this as part of her meditation for birth preparation. Next, please. So how does this formula work and what are the ideas behind it? The uterine chi is strong and tight and we want to help it unfurl. And if you've ever been at a birth, you watch a precious one, as they come out, they unfold, literally. In this formula, we're using some blood-moving herbs, right? Wine-treated dangui, jiu dangui, bai xiao, and chuan xiong to nourish the blood and move the blood and also nourish the kidneys, right? Because once we're using wine, we're doing that. Hopo is used with them to help guide the chi down, right? So we want to nourish the blood, move the blood, guide the chi down, encourage the baby to move down, resolve wetness and stasis. Stephen Clavey reports using that Hopo's in this formula to make sure the birth process is not obstructed by the blood that nourishes the fetus. Next, please. Qiang Ho and Jingjia, that's a typo, I apologize, both enter the Tai-Yang meridian, which unfurls and opens the whole back of the spine, right? When the Tai-Yang channel is healthy and open, all other channels are healthy, right? When we are looking to open to help with birth and open the pelvis and open the cervix, this is the energy we want. And Zhi regulates the chi and unfurls the frontal chi, so the fetal chi is restrained but not obstructed. Chuan Beimu and Tu Sitzi are the best herbal medicines to support the fetus to a successful birth, according to the authors of this formula. They unfurl the fetal chi, and Huang Qi is added because it supports the Yuan source chi to unfurl and flourish, which supports both the fetus's rotation and movement. And as we know, it extends mom's chi to the limbs. Next, please. Thank you, Jeff. The raw ginger moves, right? We know this, right? Herbal medicine 101, dry ginger stays, raw ginger moves. So it unblocks the clarity of spirit Shen and clears noxious filth and warms and moves, right? It shifts nausea and supports the unfurling of the primal chi, supporting the stomach chi. Again, we want the stomach chi supported because we want the banks of that river strong. This beloved and the beloved herbal medicine Gansao does what it does best, right? Harmonizing the formula, helping all the team members work well together, right? This is what we want to have happen for this birthing parent and this precious babe. Next, please. So, you know, many people don't modify this formula. I do because Dr. Yat-Ki Lai and Dr. Susan Chen, who taught at ACTCM when I was there, were both trained pre-cultural revolution and both felt that it was important for us to identify and know how to modify a formula in the event that we needed to. So I 100% do that, right? And I have people make the formula, but I have people make a separate pot with 3 slices of fresh ginger and add the fresh ginger water. But that depends what's going on with the patient, right? If somebody's really yin deficient, I'm not going to do that, right? And I'm going to add some sheng di to the formula, right? You can use granule shengjiang as well. And I give 9 grams 2 to 3 times a day, depending on the patient's willingness to comply and their constitution, right? And how the formula is modified. If there's no reason to suggest, there is no reason to suggest something a patient's unwilling to do. So if you have a patient that's not open to herbal medicine, it's not valuable to speak about it to them. But, we can teach them other things like how to use a hula hoop, how to do hip rocking. In that case, I would talk to them about getting naked and having their partner behind them and holding their belly and doing hip circle swinging, or sitting face to face and holding hands and creating eye contact, because that shares chi and that generates oxytocin, which is going to help create the space for this precious, beautiful, brilliant baby to come. And sometimes parents don't know that they need to help create space. Sometimes parents don't know that they need to step outside their life. I had a patient whose waters had broken, and their midwife was calling me and texting me frantically, asking if I could see them. I said 100%. She said they want to come to this office, not that one. No problem. Got them set up. They came in and she was texting someone. I said, so how can I best support you? What's going on? And she said, well, I have to go back to work after this to do something. I said, okay. So I want to make sure you're in touch with your midwife after this. And I want to invite you to know that you can come back if you'd like, because it's hard to create the space to open and relax and go into the birth space when you're thinking about work. And this person she had planned a home birth, ended up in the hospital, had a great vaginal birth in the hospital. And everybody ends up birthing where they're meant to birth, right? That's what I have to believe. Next, please. Okay, is it all about the formula? No, it's not the formula. Just like it's not all about the acupuncture, right? It's about finding the constellation of pieces that work for this person in front of us. Some people might have anger and resentment. Some people might have a lot of fear. Some people might be so afraid of pain that they can't even talk about it. And so we have to look for where's the access point to meet this person, and which of our beloved acupuncture points are going to help us on that journey. Is it heart 7? Is it ear shen men? Is it both of them? Is it liver 2 and 3? Is it tongue, liver, anger points? Right? Use the skills that you have to best support your patients to do that. This formula works very well in conjunction with the following, right? Taking care of nourishing and nurturing the birthing parent to make sure they're living in moderation, feeling and being comfortable, safe, and not like a watched pot. I encourage people to change their outgoing message. One of my friends was fed up with people asking her 32 years ago if she'd had the baby. So her outgoing message was, no, I haven't had the baby yet. If I had, don't you think you'd know? Which is funny, but also setting that boundary. And sometimes it's valuable for the partner to set that boundary, because sometimes there are invasive parents or in-laws. And so you can say, you know what, this is time to let your partner handle that and you to not have to, right? Any questions about creating an invitation for birth, or how and why I use the 7 princes?
Well, Amy, we do have a few people who would really like to hear you sing the song.
Oh, sure. Okay.
There is one question about the formula. So
yeah.
First, before you sing the song,
Okay.
When you give the formula, which week?
I give it at 37 and a half weeks. Even though, traditionally it's used in the 8th month. We live in a very litigious society, and I don't want anyone, in this environment to be able to come back and say, you gave me this formula and this caused this, even if it's correlation, not causation. It's a chumrah, it's a fence, it's a boundary. Does that make sense?
It does. And then looks like a follow-up is, can the formula be given after 37 weeks?
100%, absolutely, especially if someone is post-dates. I mean, we can also use black and blue cohosh at that point, which is not Chinese medicine, and which you definitely want to run by their midwives. But if someone is at 40 weeks and there's no signs of labor and no signs of a soft cervix, this formula will help.
All right. And actually, there's a question that's not in regards to this, but since it's in the chat tab, I'll just get it out of the way now while we're talking.
Yeah, sure.
Do you have any support for, or any advice for supporting a family that's having quintuplets?
Yes. So in part of that is postpartum resources, but the first thing they want to do, and you want to do with them if they're not already, is you want to make sure if they're going to nurse at all, even in some kind of rotation, they want to get a twin breastfeeding pillow called My Breast Friend. They're going to want to get in contact with groups of multiples. And they're definitely going to want to visit the NICU of the hospital where their babies are likely to be and find out the policies. And if they were in my office, one of the things I would encourage them to do is advocate in advance to have one of the recliners that they have at every hospital, to let the hospital know they want one parked right next to their group of babies and that they're going to be there doing skin to skin with their babies. And if there's any argument, you can give the family research about skin to skin, the benefits of babies growing better, nursing better, and leaving the ICU sooner, which is hopefully everybody's goal. So I hope that's helpful.
Extremely. So I'm gonna say, sing the song whenever you want, and I'm gonna get off the screen.
Okay. So again, this song can be modified for painful menstruation. It can be modified for baby coming. But in this moment with this woman, and after I sing the song, I'm going to tell you what happened. We sang it for milk flow, which I've never done before. I am a hollow bamboo. Open up, let my milk flow through. I am a hollow bamboo. Open up, let my milk flow through. I am a hollow bamboo. Open up, let my milk flow through. And one of the things you want to do with that is you want to sing it with your patient and create a moment of the two of you sharing that moment as you sing, because that creates space and openness. Now, this mom who was told by, an IBCLC who's really well respected, and who we know has lots of experience, and that was mom's response, was really unsure. So I had her, she texted me the night before she came in, I had her order More Milk Special Blend, which has go-through in it and builds breast tissue. She was already pumping. And I said, I want to give you permission to support your milk to come in. And this person is a healthcare provider, and she's spoken to other healthcare providers, and she knows it's not out of the realm of possibility for her milk to come in so late, but it was very recalcitrant. And I said, well, let's go with recalcitrant and let's see what we can do to coax your milk to come. So the day after she was in my office and I treated her to increase her flow, and she walked out with herbal medicine and she was waiting for the go-through to come. And we had already spoken about domperidone, which is a medication you can take that's serious and really helps women makes people create milk so you can chest feed or breastfeed, right? And also you can theoretically, I have seen women chest feed and breastfeed adopted children using domperidone, but this baby, she exceeded the weight goal they had set by 3 times. And mom was over the moon. And she was feeling guilty because the night before she had just nursed her and hadn't supplemented. And she was looking for breast milk from a milk bank to supplement with. And then her milk came in. But her milk came in a week after the baby was born, which is very atypical. Sometimes things are atypical, but we can create space for that. Or I could have supported her to stay in fear that her milk wasn't going to come in, so she should just start supplementing right away. So if you are not a CLC, I want to encourage you to develop a relationship with an IBCLC, which is a higher level of lactation counselor, because you need to know when to refer out. And that's one of the things we do best, and that's another way we provide value in having resources. Next slide, please, Jeff. So, you know, what can we do for postpartum care? You know, whether someone's sitting the month or not, it works for some people, not others. I don't drive for 30 days. I just don't. After I have a baby, that's not everybody's thing. But, you know, remind their family and themselves that they've just completed a marathon. An acupuncturist in Vermont, who's an old friend from Brandeis, posted something the other day that said something like, Europeans go away for 12 weeks for vacation. Americans post, I'm stepping out of the office for 2 hours to have a kidney procedure, but I'll be back. So we want to encourage her to take time. Raven taught me that for every day you do not take in the first 30 days postpartum, you add a month onto your postpartum recovery, right? This person has just completed their own personal physical, emotional, and psychological marathon. And they will need their hands, hearts, minds, and spiritual recovery from the birth, from learning to breastfeed or chest feed, and from working to meet this new person's needs. Some babies are easy and some are not. Next, please. So going to mealtrain.com, you can ask them, you know, I'll bet one of your friends who loves you the best would love to do this for you, because people ask what to do and they don't know what to do. So ask to start a meal train. They go to mealtrain.com. You can list what you want to eat, what you don't eat, what the needs of your kids are if you have them, when you want the meals delivered. And please tell them not to give it in Aunt Sally's beloved crock that they gave you for their wedding. And why don't you want this? Because you don't want anyone to have to return it. Please ask them, please ask everybody on the meal train list, or encourage your patient to ask everybody on the meal train list to use something disposable and promise they'll recycle it, you know, because we don't want to add any stress at this time, right? We want to focus on getting and maintaining physical warmth for the new mom. There's a mother roasting tradition in many cultures, just not the US, right? The US, the first thing people want to do is give you an ice pack to put on your yoni. You know, that may work for some people if they've had a lot of trauma, but it was the last thing I wanted. A sitz bath, and this is where Chinese herbal medicine comes in, right? A sitz bath with hot water, or with, you know, little bit of huanglian, you know, shuchuangzi for itching, bite, you know, depending on what's going on for her, you may want to add other things. But an easy Western herbal medicine is white willow bark, uva ursi, and comfrey root. You want to make sure nobody ever drinks comfrey root, but those three things help tissue heal. And white willow bark is what aspirin comes from. So sitting in a sitz bath with them in the toilet will be valuable. We want to make sure that if the parent is breastfeeding or chest feeding, they have a really good pillow. The Boppy is a great name, but it's not a good nursing pillow. We want to make sure that the parent has a nursing stool to bring their feet up to the right height, because some people are really short and it makes it hard to nurse. Now, this healthcare provider, again, I said, let me watch you nurse. And she went like this. Well, what's the problem with that? Is number one is habits, right? And she's like, oh, I'm doing it, aren't I? I said, yes, you're bringing breast to baby instead of baby to breast. It may take 3, 4, 5 pillows. In the beginning, it can be awkward, right? But have mom have a setup at home where she feels safe, or parent have a setup where they feel safe, to make sure that they can breastfeed or chest feed the baby in ways that they're comfortable with, right? Because if baby is not facing you completely in the beginning, that's going to create bad habits and problems. Why? Because baby's going to be reaching for the breast, and that's not going to work. When baby's 4 weeks old, baby can do that. But as a newborn, baby needs to be facing the breast, and baby needs to be brought to breast. And you also want to remind baby to open. It sounds silly, but it really works. Some babies open right away and find the breast, and other babies need reminders, right? They have executive functioning challenges or they're overwhelmed, right? And this is when, again, we work with allied providers, right? You can teach mom Shonishin baby massage, or maybe, you know, bring in someone who does network spinal analysis. Some people specialize in babies. That's something that my husband does. He goes to people's homes and adjusts them right after birth. And often those babies are much more organized around feeding after that. So when you've had said open to baby, you can have, this is a place where a spouse can be really helpful to press into baby's hand. It's a reflex for baby to latch and say, latch on when you're doing it. Again, some babies do it organically, some do not. When I had my 5th child, my 4th would just float through the room. And whenever he saw me bringing the baby to the breast, he'd go, latch on, baby, like to remind me to remind the baby. It works, and it's a cue for baby, just like we have cues, right? We want to give our babies cues. Okay. Yeah, so we just want to make sure that, and if you have the skills, that's terrific. If you don't, you know, having the name of a couple of IBCLC's lactation counselors who are supportive and kind and gentle really matters, because everybody's different, right? And everybody's personality isn't going to choose the same person. That's why it's a beautiful thing that there are so many of us out here, so we can meet the needs of different people. Slide, please. Okay. So one of the ways that we support postpartum healing is skin to skin, right? And one of the ways that babies can be retaught how to breastfeed if they have problems is to put them on mom's belly and let them crawl up and find the breast. And it's an amazing thing. Thomas Rygar, a Swiss MD, talks about this. And that was taught in my lactation counseling class, right? But wearing your baby, what does that do? Wearing your baby, has baby close to you, has baby feel your heartbeat, your partner's heartbeat, right? And babies nurse better, right? And in the beginning, it's all about this precious one, learning to nurse, learning to get organized. A well-fed baby is a happier baby, you know, and fed is best, right? I want to be very clear that breastfeeding doesn't work for everyone, and we want to make sure that no parent is shamed for choosing to use formula. At that point, we want to guide them to find the best formula for them, and maybe milk bank if they're open to that. Different things work for different parents, and we want to support them and make sure that nothing that we do has them feel judged or shamed, right? And making sure that parents know that, you know, if your partner's a really different size than you are, you may need 2 carriers. You may want 2 carriers because you have different preferences too. But wearing the baby is easier because it gives you hands-free, and it also has baby on you. Baby's going to breathe, right? There's never been a case of a baby dying of SIDS when someone is wearing baby appropriately and baby can breathe, right? So for American women, it's hard to ask for help, and it's hard to take help. So I want to remind us all that one of the biggest gifts we can give our strong patients is to remind them that it's strength, not weakness, to learn to receive. Rabbi Abraham Tversky wrote over 80 books. He was a prolific rabbi, he's a medical doctor, he's a psychiatrist, and he did a lot of work in 12-step. And he was working with someone, and he said, Khani, you know, I know you've been helping Sarah so much, you know, but I'm asking you to let Surala help you. Are you ready to receive Surala's help for this issue that you had? And Khani looked at him and said, no, Rabbi Tversky, I couldn't. And he said, okay, then you're not ready to help Sarah, right? We have to learn to receive. And starting with our type A patients, we want to start that early on. Again, it's about planting seeds, right? It takes a while to grow a garden. We don't just throw seeds over our shoulder and walk away. Oh, we till that soil, right? We add nutrients to that soil. We add water. and we give love, and we talk to the plants, right? So we want to work with our patients, our clients, to help them through places where we see them likely to get stuck in birth or in postpartum. I encourage folks, because everybody has one of those people in their family. My father, of blessed memory, was that guy. We had lists of things for him to do because he needed something to do, something he could control. So we sent him shopping because he needed to go hunt for things, right? You know, old time hunting and gathering. That's what my father did best. So we sent him hunting with lists. But if you have someone who you know is going to get antsy sitting around and isn't a space holder but needs a job, make sure you teach your patients how to make lists of those jobs so they have them rather than feeling like they're pulling their hair out because this person is making them nuts, right? Something a partner can do is make sure that there's enough pillows around. Make sure there are dried snacks, whether it's jerky, whether it's a vegan bar, whether it's dried fruits and nuts, right? On a table near the chair where the parent nurses, and make sure that there's always water and electrolytes nearby for that person. Next, please. So Raven taught me that mastitis is a breast infection, but we get it from doing too much. And you'll see some patients never get mastitis and some patients get recurrent mastitis. You know, I got a call from a friend of mine. This happened with both of his kids, when his first, who's, you know, in his 20s, and his second, who's in the double digits. And this person said, oh, my partner doesn't feel well. My wife is having all these problems. I said, when did she give birth? Oh, a week ago. Okay. Do you have stairs? Yes. Okay. How many times a day is she doing the stairs? Oh, I don't know, 20. Okay. When someone has stairs in their home, it's up once a day, down once a day for the first week. After that, it's what they feel like. But this is about protecting your energy. And depending on how long they push, it can feel like your pelvic floor is going to fall out of you. You know, Moxa is our friend. Baihui is our friend to lift that. And we want to protect our energy by resting that first week. We know mom's doing too much. If her breasts start to hurt, if they feel swollen, if she has a red hot spot, that's a clogged duct. You want to refer out to a lactation counselor unless you have the skills and knowledge and abilities to deal with that. If she has an increase in her lochia, in her flow, you want to refer her back to her midwives. If she starts bleeding and then stops bleeding, treat her and also refer her back to her midwives. If mom is profoundly fatigued or in tears all the time, you want to have her evaluated. That's the next slide. If mom has insomnia, that's also a red flag that we want to pay attention to. And if the parent shares they're having trouble connecting to the baby or have fantasies of hurting the baby, please support her to be screened for PPD, postpartum depression, and use the resources on the next slide. Next slide, please. Some hospitals are now screening automatically for postpartum depression. Some are not. But the biggest thing you will find is mom doesn't want to hold baby. Mom has trouble connecting with baby. This is serious. This is deadly serious for her mental health and for baby's potential health. So getting mom support and knowing where that support is in your community is vital, right? If mom has anxiety, depression prior to getting pregnant and you've worked with them, or OCD, we want to be mindful and encourage them to be working with a therapist to have a postpartum plan, right? And if you have the knowledge, skills, and ability, you can be part of making that plan. But it's really important that a plan is in place so there isn't a crisis, because that can be avoidable, right? And a fabulous book that I love is And Baby Makes Three by Dr. John Gottman, PhD, who runs the Lub Lab in Seattle. A book I recommend all parents get as soon as they find out they're pregnant. You can, next please, Jeff. Thank you for running all of it. Is How to Talk So Kids Will Listen and Listen So Kids Will Talk. And I joke when I say, please put it in the bathroom because that's where men read. But really, that's where people read, right? It's got cartoons. It's an incredible book that I want people to read when they're pregnant. Why? Because if you don't practice the skills, right, we have to practice throwing a ball. We practice inserting a needle. We practice interacting with our patients before we ever interact with a patient. If you don't have children and you don't use something like this book, and this book is not a you must do this or your child will be messed up for life. It's about handling different situations and learning language and communication skills to teach you to effectively communicate with your child and your child to effectively communicate with you. Because otherwise, when your child is 2, your child will do something, and the things that you swore you were never going to say that were hurtful to you as a child are going to come flying out of your mouth before you even realize you said it. And then you're going to go, what happened? And this book teaches us because it's about building skills, right? Just like we build skills when we learn points, when we learn, points in acupuncture school, and when we learn herbs and we learn the individual constituents and we learn the formulas, we want to learn the skills, right, of how to communicate effectively. And one of my kids, and this is a child who has some sensory challenges, was at school in kindergarten, and a child really wanted him to do something and was really pushing him to do something. And my child turned to this child and said, I hear that you want to do that. This is what I want to do. And it's really okay for you to choose to do that and me to choose to do this. And he wouldn't have had that language if he hadn't heard it. So I want to invite you, for all of us, to do this, because the book should really be called How to Talk So People Will Listen, and Listen So People Will Talk. Next, please. Okay, so thank you so much for joining us. I value feedback that you have about how this could be more effective, or what worked for you and what could be more effective. These are all ways to reach me, and I'm happy to answer any questions.
Well, based on all of the comments and the feedback in the chat, and I would say that you can't do anything different. Just keep doing what you're doing. Everyone loves it.
Okay, cool.
So it was a really beautiful presentation, and I know everybody just gained a lot of insight that they may not have experienced before, so we all want to thank you. We do have a few questions, so if you would not mind, I can start getting into them.
Sure.
So let's see. If a patient has had multiple miscarriages in the past, is there an additional formula that you would recommend to support that?
So yes, I would use an additional formula, but it depends on how they presented and what they presented with. And again, you can go to my website. There's an article about heat therapy. That's most likely something that would show up for them and that I would want to read for them. I would want them to read and to teach them, and this is about how they can use a hair dryer at home, right? Because heat is heat. Dr. C.S. Chung taught us, you have your grid for diagnosis. We have our grid for treatment. You find something that works for your grid for treatment, you put it in your grid, and you know what category. It's going to tonify, it's going to warm, it's going to nourish. Okay, a hair dryer it is, because not everybody's comfortable using Moxa at home, and not everybody's spouse likes the smell of Moxa at home. So there's an article about that on my website, and I have a card that's currently somehow not on the website, but my web guy will get it up. So depending on what's going on for her and what your diagnosis is, there might be different formulas. You're welcome to reach out to me, and I could process that with you if you're thinking about a specific patient. But also, I also talk with patients about warming foods, right? The quickest way to think about this is I tell them, if your body were an ATM, you have something warm, you're nourishing the body and giving your body the energy to digest that food. When you have, it's an automatic deposit, an energetic deposit in your energy bank. When you have something cold, it's an automatic withdrawal of your energy bank, and room temperature's a wash. And then we talk about Japanese and Chinese restaurants. What's the first thing they give you? Tea. What's the next thing they give you? Soup. Okay. So they've given you 2 things that are warm and nourishing to help you digest what's coming. Oh, and what's the third thing? If it's a salad, it's marinated. So then I talk with them about making sure that if they're eating salads, that they come out of the fridge, because salad is cold in temperature and cold in nature, that it warms up to room temperature, and that some kind of marinade is used with a vinegar or lemon juice, because marinating is cooking, right? So it warms the temperature and warms the nature, because we don't want to tell someone to change everything they're doing, because they're not going to do it. It's, where is this person? How can I meet them where they are and make some slight adjustments that they're willing to make and have the buy-in for, right? Because that's the only way we're going to be able to help them make effective, meaningful change. And it's probably a multi-layered thing with multiple miscarriage, at least in my experience. And she's going to need either she may need, not going to, but she may find therapy valuable, EMDR if she's had trauma, hypnosis if she has fear that she's not going to get and stay pregnant to term, because there's some rewiring that's going to help her if that happens, right? To help her reframe that.
All right, next question. When would you suggest a patient go to a pelvic floor specialist postpartum?
So that's an interesting question. And what I want to say is it depends on the patient and it depends what's going on. I know it's like the latest rage, and I want to put it in the category of, oh, it's the latest rage. If somebody truly has pelvic floor dysfunction, they need a pelvic floor specialist. Everybody does not need one. Gesundheit. I have 6 children, and I can exercise without leaking, and I never saw one. So I'm not, it's just that if someone has a traumatic birth, I would check with their midwives and I would follow the guidance of their midwives, about when they feel like it's appropriate, because we want to provide all sorts of services to our patients and we want to stay in our lane. Right. And that for me, that's in the midwifery lane, unless somebody is 2 years postpartum, leaking urine, not having any more kids and sobbing in our office. That's the time when you refer to a pelvic floor specialist in your area who specializes in working with postpartum women. I hope that answers the question. And that's my opinion, right? Opinions are like noses. Everybody's got one. Just because someone's is bigger doesn't make it right. But in my experience of living life and working with pregnant persons, that's my lived experience.
So we do have 2 more questions. I see them in the chat. So first question is, do you typically see postpartum patients in your office or do you do home visits for them?
It depends what they need. Often, I have to charge more if I'm going to their home. So if it's someone I've seen throughout the pregnancy or worked with them when they were working to get and stay pregnant to term, and then throughout the pregnancy, I will do a postpartum home visit as a baby gift to them. But if not, I will go to people's homes for sure if they don't feel safe coming in. But if someone can come in, it's just less expensive for them to do so, if it's possible, and it may not be possible. And that's a question you have to ask yourself about what you're willing to do and what does that look like for, how you can see patients. If you're, how far away is it? How does that impact the rest of your patients and your practice? And these are all really terrific questions that you get to ask yourself and see what's right for you, to be authentic with you and how you want to practice.
The last question is that people would like the words to that song again.
Oh, sure. I can type it in. Is that helpful?
Yeah, and actually, I don't think if you wouldn't mind typing it in, and then maybe singing it one more time, because I think everybody really enjoyed that. I know I did.
You're so funny. Now, you would only use one of these words, to be clear. I'm writing multiple words, but you will only use one at once because you use the one that's most appropriate at a time. And you do want to sing it with the person again, because this is like it's a rhythmic mantra-like song. And so these tones, so it's the words, it's the tone, it's the presence and meeting them. It's all of these things together, right, that help create this shift, right? And I just want to share a little story. Judy Brock, who's the grandmama midwife of Western Massachusetts, she sent a patient to me once, and I treated her, I worked with her, I sang with her, and she calls me, "What did you do?" "Judy, what do you mean?" "She came back a different woman. I sent this uptight person to you, and she came back open, and her cervix is soft." I was like, well, that would be my expectation and hope and deepest hope, Okay, so here's the song. I am a hollow bamboo. Open up, let my babe flow through. I am a hollow bamboo. Open up, let my babe flow through. I am a hollow bamboo. Open up, let my babe flow through. And just being present with someone and sharing chi with them and creating the possibility for them to perceive something differently, it heals the world. So thank you all for your willingness to be present with considering this as an option and another way to support your patients with authenticity.
Amy, this was such a beautiful, beautiful class. Thank you. So I said it before, everybody really enjoyed. Everyone wants to thank you for your time. I do know that you're speaking at the Atlantic Symposium in November, but it's not about birthing. It's about advocacy, if I'm correct.
Well, I'll be speaking about tiered licensure. So different tone, different voice, but
same human.
Yes, same person.
And also you're involved in the ASA conference, which is happening in September.
It is, and we invite you all to come. There are a lot of exciting things happening. Li Ming Tseng, our conference chair, is working very hard to create as many ways as possible to make it interactive and to pick the best and brightest brains, and Jeff and I are both on the conference committee, to make it the best it can be and to be of value to all of you.
Well, I want to thank everybody for taking their time out tonight to listen to all of this wonderful information. Our next webinar will be happening on Tuesday of next week, featuring Michelle Gellis on facial cupping and gua sha self-care for acupuncturists. So don't miss that. You can find registration on our blog. And then on July 10th, which is Saturday, we're going to be co-hosting with the Florida State Association for Oriental Medicine. We are going to be doing another edition of Love Your Practice, which is the Practice Management and Growth Digital Summit. 100% free. It'll be all day from 9 a.m. till 4:30 p.m. We're going to talk about email marketing. We're talking about SEO. We're talking about ADA and HIPAA compliance and so much more. So really don't miss all of these events. You can find them all on our blog. And again, thank you to everyone. A huge thank you to Amy. And we hope everyone has a lovely evening.
Be well. Let me know how I can be of service, Jeff.
Anytime. All the time.
Okay.